Welcome to this month's program, Focus on Health. Now, I normally give you all a teaser. So the teaser is going to be that this program is primarily for seniors. This program is geared primarily towards seniors. Is that about right, Cheryl?
That's correct.
See you on the other end of this commercial. Okay, we're good. You all right? Welcome back to Focus on Health. Did you guess what this is about? Well, if you're sharp and you say that it's about open season for Medicare, you can move to the top of the class. To my right, I have Ms. Cheryl Maddox. And Cheryl, I want you to look into that camera right there and tell everybody all the information about you, your position at the Area on Aging, what you can provide for them, and leave all your contact information, how they can call you and everything, right in that camera there.
Okay. Hello, my name is Cheryl Maddox. I'm the Georgia Cares Coordinator at River Valley Regional Commission. I am part of the Area Agency on Aging. And at Georgia Cares, we help Medicare beneficiaries choose the best plan for their medical coverage. Our services are free. We do not work for an insurance company. We do not sell anything. We are just here to provide you with information to help you make the best choice.
And that's what I like about the program. This program is completely unbiased. It's for seniors, and it falls under the state health insurance program.
That's correct.
Right? And Cheryl, if you can just either look in this camera or we can talk. This program is the only one that gives unbiased information, education,
That's
and
correct.
advice to seniors. Every open enrollment, when this period comes around, I always try to tell individuals to call you.
Thank you.
Because you can, each time formularies change.
That's correct.
So what a senior may have on that formulary, they may not have if they don't do a little bit of shopping and contacting somebody like you to more or less make sure that whatever plan, original Medicare or either an Advantage plan, covers them as far as all the tests that they want, but as well as the medication.
Yeah, we provide Medicare education even before you start Medicare, even during while you're on Medicare. But with open enrollment coming up, this is the time for people to call us and look at your plans and compare it to plans for 2019.
Right.
Because like you said, there are always changes. The doctors that you have may be leaving the plan.
That's exactly
The pharmacies that you use may be leaving the plan. That plan may no longer cover your medication, or there may be plans out there that that medication may cost a little less.
Yeah, I'm glad you brought up something else that I omitted. Even individuals, as they approach Medicare age, they can call you on the phone and get advice.
Yes, because when you become eligible for Medicare, you have a 7-month initial enrollment period. So you have that 3 months before your 65th birthday, unless you're on Social Security disability. Then you have that month of, and then the 3 months afterwards. And I always tell people, during those 3 months before your Medicare starts, that's the best time to start, getting educated on Medicare and looking at plans, so that when that month comes that your Medicare start, you'll be ready.
Right.
And not trying to scramble at the last minute to figure out, what I need to do.
So they have a 90-day window. Is that what it is?
Right before. It's 7 months total, but it's 3 months before the. Because if your Medicare starts the month of your 65th birthday.
Right, that's correct.
So you have those 3 months prior to that to sign up for a plan. It still won't start until that month, but you can go ahead and look at plans and sign up with a plan.
Acquaint yourself with plans and find out what option is best for you.
Right. Whether it's a Medicare Advantage plan or a Medigap, or just decide if you want to stay with original and just go with a Part D drug prescription plan.
Okay. So let's start with the first slide. Talk about Georgia Cares. That's Cheryl's information. Next one, please. There we go. Says Georgia Cares is the state health insurance assistance program. It is your local help for Medicare. And we just got finished talking about the fact that just how beneficial this program is for seniors. And you provide confidential and unbiased information on Medicare. You help people with Medicare understand their choices and enroll in a plan that meets their needs. You also provide one-on-one counseling, community education, and outreach. Something that I found out, Cheryl, because I've used your services and sent so many people too. When you call on the phone, a lot of times, it's even happened to me, when you're talking to someone on the phone, they still not be able to explain to you satisfactorily what your questions are.
Right.
But when you're sitting down with you can ask any question that you wish. You're very patient, and you can explain things. So it's very difficult for seniors to navigate the system telephonically.
Yeah. Sometimes that is the case, and I'm the person I gotta see it. I understand it better when it's in my face.
Right.
So if people, they're welcome to call and make an appointment to come into our office. If they are unable to get out of the home, they're homebound, we will go to them and provide.
Oh, do you go to them?
Yes,
Oh,
sir,
that's
we
awesome.
We do. We go to them. We have 16 counties that we are responsible for. We go outside of Muskogee County to their homes and in Muskogee County too, and provide that counseling and enroll them in programs and explain to them Medicare benefits.
Would you explain to our viewing audience how many counties are in your capture area?
Yeah, we have 16 counties, starting from Muskogee County, Harris County,
All the way down to Dooley County.
all the way down to Dooley County, Crisp County, Marion County, Macon County.
So it keeps you have pretty much a lot of windshield time then, don't you?
Oh yeah, but we have a team. I don't do it alone, so we have other counselors and volunteers that
For
help
some
with
of you who
this.
may not know, Darian is over here to our left. She said she didn't want to be on camera. But in any event, can we go to the next slide, please? Now, what is this here that we're looking at?
So this talks about the open enrollment period. This is your opportunity to where if you're on original Medicare with a Part D plan, or you're in a Medicare Advantage plan, this is your time of the year to make a change. Whether you want to change to another plan, drop what you have, and go back to original Medicare, this is that time frame to open enrollment.
Okay, now prior to us coming on, Cheryl even explained some things to me, so we're going to take a little bit of time with this right here. Okay, so now, Cheryl, October 15th is when open season starts.
Yes,
Okay, so anyone who's on original Medicare like I am,
yes,
or anyone who's on the Advantage plan,
yes.
can come here and you can talk to them and advise them that the best plan will be for them to stay on their plan or to choose another plan once you find out what their health care needs are.
Right. We'll put their medications, look and see who their doctors are. We'll put all of that into the system. If they're on a Medicare Advantage plan or even just a Part D plan, once we put that in, the system will bring up the top 3 best plans. for their needs.
I see now. So the system, once you input that information, the system will spit out the best plan for that person.
Right. And then
That's awesome.
Yeah. And so
That's
we'll just-
awesome. So now that's starting the 15th of October,
That's correct.
and it runs all the way through to December 7th,
Yes.
and then 1 January is when they can use the plan.
Right. That's when a new plan will go into effect.
Okay, so now explain to them what Part D is.
So Part D, that's your drug prescription plans. Some people, they may have just original and a Part D, or they may have original and a Medigap plan and the Part D. But the Part D, that's the plan that covers the cost of your medications.
Right. Explain to them, because a lot of individuals, what's Medigap?
Medigap, that's a supplement to your Medicare. With Medicare, with Part A, you have a deductible that you pay for the hospital. With your Part B, Medicare pays 80%, and the beneficiary is responsible for 20%. So there are different Medigap plans that you can choose from to help cover some of that out-of-pocket
That
cost.
20% of
That
the
20%. Yeah, most people go with one that covers the full 20%.
All righty. Okay, so now we've gotten through that. So now let's go to the next slide. Now explain to our audience what we're looking at here.
So starting January of 2019, this is something new that CMS will implement. It's called a Medicare Advantage Open Enrollment period.
Okay.
It's for those people, you have to already be on a Medicare Advantage plan, but this is your opportunity that if you have a plan and you do not like the plan that you're in, you can change Medicare Advantage plan, or you can go back to original
Medicare.
original Medicare.
Okay, all right. Well, so this is just for individuals, say like for myself, say I'm on original Medicare, and say in October, I say, Cheryl, I think I might want to try an Advantage plan. So I try the Advantage plan, then come, and January 1st, I said, you want to know something? I don't like that Advantage plan. Cheryl, can I change back?
Yes.
Okay, or I might say, can I see if I can get another Advantage plan?
Yes, that's the option.
Good. But then after I do that, I'm locked in until next October into this thing.
Right.
Once I make a final decision.
That's it.
So this is just a way, this other period, which didn't used to be before, by the way, y'all, it just used to be one period.
Right.
And they just put this in here, it just as a little leeway for seniors if they wanted to try something else. Is that right?
That's correct. It's doing open enrollment, doing the open enrollment from October 15th to December 7th. If they went into a new plan and they discovered that wasn't a plan for them, that's an opportunity for them to try another plan or go back to their original plan.
All righty. Let's go to the next slide. Oh, now I've sent individuals to you about this here, but would you explain, because I know a lot of the seniors don't realize that this is available for them. It's called what? Extra Help.
Extra Help. So it's a plan to help Medicare beneficiaries with their drug prescription costs. It also covers your deductible. If you pay for a Part D premium, it'll cover that. For 2018, if you qualify for the program, your generic medications will cost $3.35.
Oh, great.
And if you're on a brand name medication, it's $8.35.
I see.
And we can do that application over the phone. It takes less than 10 minutes, and they will receive an answer within 2 weeks.
Because what I find out in the community, talking to a lot of seniors, they have their prescriptions, but then they don't have the money to fill the prescriptions. So this Extra Help is definitely something that the seniors should look at. And I'm just going to read the slide. It's a program to help people for Medicare prescription drug costs, Part D, as you said. It's also called the Low Income Subsidy.
Yes.
If you have the lowest income and resources, you end up paying no premiums or deductibles, as well as a small or no co-payments. This is going to help a lot of seniors. This is and I'm quite sure that you do get a lot of seniors asking if something like this is.
Oh yeah, people call us all the time. You know, when they first call in, they was like, "Hey, I need help paying for my medications," and they think that we have the finances in our office, but it's a program that we sign you up for.
Right.
And we do it all day, every day. And I always tell people, even if you're unsure whether or not you qualify, let's put the application in anyway.
Right. I think that's a good idea. Now, if I did something like that, would that cover me throughout the whole year to the next enrollment time?
Yes.
Are you serious?
Yes, it covers you. Most people on the plan for a year, and then sometimes you may receive something saying that you need to verify your income again, and sometimes it just continue to roll on for the next year.
If they do get, and what I like, by the way, I know the answer to what I'm saying to Cheryl. If there are any questions, what I like about Georgia Cares, they're no more than a phone call away. So if you have any questions at all you got to do is get on the line and give Cheryl a call. And Cheryl, before we go to break, and we're going to go to break right after we do this, please look into this camera and let them know how they can get in contact with Cheryl and Georgia Cares.
You may give us a call at 706-256-2917. Again, that number is 706-256-2917.
And Cheryl, tell them where you're located at in case they want to come down there and visit you.
Okay, yeah, I'm located at River Valley Regional Commission. It's located downtown Columbus at 710 Front Avenue.
That's some good information, and we're going to take a break, and we'll see you on the other end of this commercial.
Columbus, Georgia, tracking your waste pickup is now at your fingertips. Download the new Columbus Recycle app to your mobile device now. It's easy, and most of all, it's free. Simply go to the App Store or Google Play, search Columbus Consolidated Government, download the app, then enter your street address. No more guessing or calling about recyclable items, garbage, other waste pickups, or holiday makeup days. This app can also send you a reminder 24 hours in advance. Download this amazing app now. Columbus Consolidated Government. We do amazing.
Don't miss the annual Tuskegee Morehouse Football Classic, featuring the Morehouse Maroon Tigers versus the Tuskegee Golden Tigers. This is a cat fight you don't want to miss. Saturday, October the 6th at the A.J. McClung Memorial Stadium. Kickoff time is at 2 p.m. Be sure to check out all the Classic events, including the Classic cocktails and networking. Don't you dare miss the Classic parade, tailgating, and one of the largest vendor fairs around. That's the annual Tuskegee Morehouse Football Classic, the granddaddy of them all.
Welcome back to Focus on Health, and I know you all are enjoying this conversation because I'm enjoying it, and Cheryl's teaching me a lot of things that I thought I knew, but I had a misunderstanding about. So this is really is as informative to me as it is to you in the viewing audience. So now, going back to this extra help, Cheryl, who funds this extra help program?
So Extra Help is a federally funded program.
So this is funded by the federal government?
Yes.
Okay. There are some other programs. Next slide, please. Could you speak about these programs here?
Okay, the next program I want to talk about is called the Medicare Savings Program. And within this program is state funded.
This is state funded.
This is state funded. So it's different from state to state, the qualifications.
Okay, yeah, so it would be, the qualifications for it would be different from state to state, unlike a federal program that all the states would pretty much, the guidelines would be synonymous.
Exactly, exactly. Because with the extra help, you could be on extra help here in Georgia, move to another state, and still be on extra help. With the Medicare Savings Program, that's state to state. So if you leave this state, you have to reapply wherever you go to.
Okay. That's some good information, Cheryl. I appreciate it. So now let's cover these. Let's go with the first one.
Okay, so the first one is called the Qualified Medicare Beneficiary, the QMB. And for people that qualify for this program, most people pay a Part B premium for their Medicare. It's like $130 or $134 a month. Well, the QMB covers that premium for them. That's money they can keep in their pocket.
Okay, so this QMB
medications.
Covers that premium, pays that premium for them.
Yes, and for most people, Part A is free, but for those people who have to pay Part A, this will also cover that premium
You
too.
can't beat that.
You can't beat that. And it'll cover your any of your out-of-pocket expenses for Medicare. That's covered. So your co-pays, your deductible. If you qualify for the QMB, all of that's covered.
Well, you can't beat that.
You can't.
Now,
beat
let me
that.
ask you something. Just it's hitting my mind right here. I know we did the extra help. That's the federal program.
Right.
Could a person apply for either one
Yes.
or both?
Yeah. Well, let me tell you this. I'm glad you said that. If you apply, when we do the application, we do both of them at the same time.
Boy, y'all off the chain good. Y'all off the chain
So
good.
if you call for one, we're going to go ahead and do both.
Somebody like
together.
me coming down there would need that. Somebody like me coming there, you have to do all my forms
Yeah,
for me.
and,
This is great.
Yeah. And most people, even if they qualify for the Medicare Savings Program, they automatically qualify for extra help. So even if even if I just did an application for the Medicare Savings Program and they got approved, it will automatically put them on extra help.
Now this is, I would like for a lot of the seniors really, I've been looking for this program really, because last period I wanted to cover it more and didn't. I'm going to try to get together with Cheryl during the enrollment period to go to a lot of sites. If you have any group that you would like to get more information about this, please give Cheryl a call, and we're going to do the number again. Because as you can see, this has been an education for me as well. And I thought that I was really versed in a lot of this here, but Cheryl's educating me as well. So Cheryl, this is awesome. So let's go down. Okay, then you got another area. It's specified low income Medicare, it's SLMB.
Yeah, we call that the Slim B.
Slim B.
The
Talk to
Slim
me
B.
about the Slim B.
So Slim B, if you qualify for that, it covers your Part B premium only.
Okay, so this is just for the 130 or 134.
Right. It just covers that only.
Okay, and now you got another one down there that says the QI.
Yeah, so that one just covers the Part B only. The income limit is a little higher for that than the Slim B, but the way that one works is because if you get on the program, you're on the program for a year. But with the QI is whenever the funds run out. So you may qualify for it, then once the funds run out, then you'll lose that.
I see. And how about this what is that, QDW?
Yes, that's for people who have to pay for their Part A, but they have to be on a disability.
I got you. Well, there's a number of programs that people can actually apply for.
Yes,
That,
sir.
and I'm assuming that this is something that a lot of our viewing audience are learning as well, because I'm really learning a lot right here. Let's go to the next slide, please. It says in April 2018, CMS started mailing out new my wife and I got ours.
Yeah,
Our
good.
Social Security cards are not on there. Our numbers are not on there.
That's right.
CMS will be removing Social Security numbers from Medicare cards. This will help keep your information more secure and help protect your identity. This is great.
Yes.
In fact, my wife and I, we got our cards 3 weeks ago.
Okay.
And we noticed that automatically we have our own little distinct numbering system. So this is really good. And it's good because, unfortunately, a lot of people prey, a lot of these predators out there prey on seniors. And once they
Yes.
get your Social Security card, you can kiss the baby.
Right.
The bottom line, they're gonna take advantage of you. Okay, it says here, your new card will have a new Medicare number that's unique to you instead of your Social Security number. Make sure your mailing address is up to date. If your address needs to be corrected, contact Social Security. Cheryl, you've given us a lot of really good information. And I have used the Area on Aging for years because no one person knows everything. But when you call the Area on Aging, they're very user-friendly, they're senior-friendly. You can call, make a reservation, get all the questions together, and meet Cheryl, and Cheryl will take the time. To me, I'll be honest with you, there's nothing like face-to-face. I don't do that well calling on the telephone, and I never get all my questions answered. And so, Cheryl, would you look in there again, and would you give all your contact information to include the address?
Okay. Again, my name is Cheryl Maddox. Our telephone number is 706-256-2917, and our address is 710 Front Avenue, Columbus, Georgia. So if you're in a social group, a religious organization, give us a call. We will come out to you. We'll bring our laptops, and we'll do the plan comparisons right there. We provide you with Medicare education and give you more details about your benefits.
And in fact, what I have in my mind to do, because I've had conversations with Cheryl, and the Area on Aging folks, their goal, they really, 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 really want to help seniors. And I'm just so thankful that we have an Area on Aging here, individuals that will take the time, because I've been to other states and other cities, and I don't know whether it's a matter of funding or what it is, but the resources for the seniors were just not as plentiful as they are here. And so please, 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 for my fellow seniors, please use the services of the Area Agency on Aging, because they are here for you. And one of the things I'm going to suggest is for a lot of the churches, I'm going to call around to see if they can get their seniors together, and for Cheryl to actually try. As she says, I will come to you. And so, Cheryl, I just want you to know, when you and Katie and Patty Cullen, who's the executive director, what a blessing it is for us seniors to be able to have the resources that the Area on Aging provides.
Thank you.
And this is not going to be your only time coming on the show, because I know there are a lot of other things that y'all do, and a lot of other programs, a lot of other members on the Area on Aging that do other specific things. Yeah. So I just want to thank you again for coming to Focus on Health. And to everybody there, I hope this program has been a blessing to you, as much as it has been for me to talk to somebody like Cheryl and to give this information to you. Until next time, God bless you.